Now we're going to see an overview of ultrasound during pregnancy. So we have three modalities of ultrasound. We have transvaginal ultrasound, transabdominal ultrasound, and Doppler. So transvaginal ultrasound, this is done during the first trimester. So each time we're going to do an ultrasound during the first trimester, we do it via transvaginal. And during the first visit, when the pregnant woman presents to the clinic, at that moment we need to determine how many weeks gestation is the patient. Normally that is done during the first trimester, and so we do a transvaginal ultrasound to evaluate how many weeks pregnant is this patient during the first visit, and then that is going to be the measure we take for gestational age during the whole pregnancy. So the transvaginal ultrasound during the first trimester is the one we use to measure gestational age. The advantage of transvaginal ultrasound is that it is not limited because of the body mass index of the woman, as opposed to transabdominal ultrasound. This one is done during the second and third trimester. Each time we're going to do an ultrasound during the second or third trimester is going to be via transabdominal. This is limited by the body mass index. We are going to have difficulty seeing the fetus with the transabdominal ultrasound if the patient has a high body mass index, for example, as opposed to the transvaginal ultrasound. For transabdominal ultrasound, we can also estimate gestational age. So if this is the first time the pregnant woman is presented to the clinic, if it is during the first trimester, we are going to evaluate or estimate the gestational age with transvaginal ultrasound, and what we measure is the crown rump length. This has an accuracy between plus minus 5 days, plus minus 5 to 7 days, more or less. So if this is the first time the pregnant woman is presented to the clinic, we want to know what is the gestational age at this time, and that is the measure we're going to have for the whole pregnancy to measure gestational age and compare with anatomical ultrasound and the next ultrasound we're going to do. That is going to be with transvaginal ultrasound and has a plus minus 5 day accuracy of gestational age. If we use the transabdominal ultrasound to estimate gestational age, here the measures are head circumference, biparietal diameter, abdominal circumference, and femur length. So we can also estimate gestational age based on a transabdominal ultrasound during second and third trimester. We always do that when we do an ultrasound but this gestational age estimation, the accuracy decreases as the gestational age increases and we do transabdominal ultrasound during the second or third trimester. The accuracy of the gestational age based on the transabdominal ultrasound is going to decrease. If we do a measure of gestational age based on head circumference, abdominal circumference, femoral length, early in the second trimester, this has an accuracy between 10 to 14 days, more or less. 10 to 14 days accuracy earlier in the second trimester. But so normally the woman presents to the clinic during the first trimester. At this time we do a transvaginal ultrasound measuring crown rump length to estimate how many weeks gestation is this patient at this time, and with that measure is what we're going to use to measure gestational age. So if the pregnant woman is 6 week gestation at this point, based on transvaginal ultrasound crown rump length, now is 5 week gestation. Next week she's going to be this time is 6 week gestation. Next week she's going to be 7 week gestation. Next week 8 week gestation, based on this transvaginal ultrasound, based on the initial measure we did with the transvaginal ultrasound measuring crown rump length. So the gestational age is going to be based on this transvaginal ultrasound first measure of crown rump length, and that gestational age is always going to be compared in the follow-up visits when we do transabdominal ultrasound for several reasons. For example, to evaluate for intrauterine growth restriction. Here, when we do this transabdominal ultrasound, basically we measure two things, which is gestational age and fetal weight. So the gestational age measure or based on this transvaginal ultrasound, always in the follow-up visit is going to be compared with a new gestational age estimation done during each transabdominal ultrasound, during each visit. But this estimation, this gestational age estimation is going to be made with head circumference, with parietal diameter, abdominal circumference, and femur length. With this transabdominal ultrasound measuring this, or with these parameters, we always are going to have an estimation of the gestational age at this point that is always going to be compared with the gestational age, or how many weeks pregnant is the patient based on the first transvaginal ultrasound it was made. So each time we do a transabdominal ultrasound, we estimate fetal weight and we estimate gestational age, and this estimated gestational age is going to be compared with the gestational age we already established during transvaginal ultrasound, during the first transvaginal ultrasound in the first trimester. And this is important because comparing this estimated gestational age at this point in this ultrasound compared with the established gestational age during the first trimester is what gives us a clue for intrauterine growth restriction. So it's important that comparison. Most of the time this estimated gestational age during each ultrasound corresponds to the already established gestational age or already established measurement of gestational age. But if there is a discrepancy, always the gestational age is the one measured with transvaginal ultrasound. But why we do a new estimation of gestational age? Because we need to do this comparison to evaluate for intrauterine growth restriction. So if in a transabdominal ultrasound we have a gestational age, for example, of 30-week gestation, but based on the established gestational age during the first trimester, the patient is 33-week pregnant. What is the gestational age? The gestational age is 33 weeks pregnant, but while we have this difference between the one already established during the first trimester and this ultrasound at this point, that could imply intrauterine growth restriction. And because the fetus is not growing, measuring these parameters, we have an estimation of gestational age of 30 weeks, but indeed she is 32 weeks. So for this is important the comparison of gestational weeks based on the first one established during the transvaginal ultrasound in the first trimester and the transabdominal ultrasound during the second trimester, even though the one we use to estimate gestational age is the transvaginal ultrasound. We need to compare with each transabdominal ultrasound during the second and third trimester to evaluate for intrauterine growth restriction. And the fetal weight, this also is going to give us a clue for intrauterine growth restriction. The fetal weight is measured based on the abdominal circumference, or what is most important predictor of fetal weight is the abdominal circumference, as opposed to what is most predictive of estimated gestational age, which is head circumference and bipyramidal diameter. And the Doppler, we use the Doppler. This is to measure blood flow of the middle cerebral artery of the fetus and the umbilical vein. This is to evaluate for fetal well-being and also, for example, to evaluate for anemia in the case of alloimmunization, which we are going to talk about this later on in the videos. And so, what are the indications for ultrasound? The indications for ultrasound is to evaluate the viability of the pregnancy, the location of the pregnancy, because we can have an ectopic pregnancy, to establish gestational age, which is going to be established most of the time with the transvaginal ultrasound made during the first trimester, which has plus minus 5 days accuracy of the actual gestational age, because the actual gestational age is based on conception date, but most of the times we does not know that date. And this measure is done with the crown rump length. We also do ultrasound to evaluate for fetal weight during pregnancy, fetal growth, which both of these, fetal weight and fetal growth abnormalities, guide us to evaluation of intrauterine growth restriction. So how do we measure fetal weight and fetal growth? This is most of the times during the second and third trimester with transabdominal ultrasound. Fetal weight is done with abdominal circumference. Fetal growth is comparing as a whole the fetal weight and what is the estimation of the gestational age at this time. So also estimation of gestational age at this visit to compare with the already established gestational age. So this estimated gestational age is done with head circumference and biparametal diameter, abdominal circumference, and femoral length. Was most importantly the biparametal diameter, what determines the estimation of the gestational age at this point. And this gestational age is going to be compared with the one established during the first trimester to evaluate for intrauterine growth restriction. Another indication is just to evaluate fetal well-being. We do a genetic ultrasound. The genetic ultrasound is to evaluate for aneuploidy. We do the generic ultrasound, which is to evaluate for abnormal structures, and we do a specific ultrasound, which is to evaluate specific things like skin fold thickness, short, long bone. So how short are the long bones? Echogenic bowel. Pelectasy, which is increase of the renal pelvis. So this is genetic ultrasound done to evaluate for aneuploidies. This is done between 18 to 20 weeks gestation. And we can also measure nuchal translucency. This is done between 10 to 14 weeks gestation, so probably this is done with transvaginal ultrasound as opposed to the anatomic ultrasound, which is done between 18 to 20 weeks. This would be with transabdominal ultrasound. We also use the ultrasound to evaluate for amniotic fluid. We could have polyhydramnios or oligohydramnios. Also for multiple gestation, we want to evaluate how many chorions do we have and how many amnions. And also for placental implantation, for example, if we have a low-lying placenta, so we also want to evaluate the placenta, and bleeding disorders. So ultrasound, we have transvaginal ultrasound, transabdominal ultrasound, and Doppler ultrasound. The Doppler is the one we're going to use for anemia evaluation most of the times. Transvaginal ultrasound, the most important is to establish gestational age during the first trimester. Transvaginal ultrasound is done during the first trimester. Even though we have an established gestational age at this time, always we measure a new gestational age based on a new ultrasound, which now is transabdominal, to compare it and evaluating the uterine growth restriction, even though the gestational age measure is always going to be with the established one during the first trimester. And we have the genetic ultrasound, or yes, the genetic evaluation we do for an OPD during 15 to 20 week gestation. This is with transabdominal ultrasound, and here we look for specific things like skin fold thickness. We can also do during the first trimester nuchal translucency evaluation. This will be with transvaginal ultrasound, and we evaluate also for amniotic fluid and placental insertion.